Hello, friends, and welcome to Pediatric Flow with Jolene. I'm so glad you're here. Today, we're going to talk about the season that we're in, the season of sniffles. It's that time of year when runny noses seem endless, the coughs linger, and RSV is making its rounds throughout daycares, clinics, and homes. If you've ever held a little one close, listening to every single breath, you know how scary those sniffles can feel. So in this episode, we'll unpack what RSV really is, what to watch for, and how we can help our littles breathe easier with a blend of science, calm, and compassion. So go grab your coffee, take a breath, and let's flow through this season together. What is RSV? RSV stands for respiratory syncytial virus. And that's a bit of a tongue twister. I even have a really hard time saying that. In simple terms, it's a virus that affects our breathing system, the nose, throat, and the smaller airways deep in the lungs that help move air in and out. For many, RSV feels like a regular cold, a runny nose, all the nasal congestion, maybe a cough, a little fussiness, or trouble sleeping. But for some of the little ones, especially babies who are under 6 months of age and premature infants, babies who are born less than 37 weeks gestation, or children with heart or cardiac problems or lung or respiratory problems, RSV can settle deeper into the lungs. That's when we start to see more serious infections, like what we call bronchiolitis, which is inflammation of the bronchioles of the lungs, or pneumonia, where there is a consolidation or an area of infection within the lungs. That is when you will see wheezing, faster breathing, or increased visible effort. Basically, what I'm meaning by that is you'll see pulling in either under the ribs or the skin or between the ribs. You'll see them begin to breathe a little faster, a little harder in order to breathe. That is what we call in the medical field retractions. There's different types of retractions: subcostal, intercostal, suprasternal retractions, to name a few. But those are things that when you go into see your pediatrician or your nurse practitioner or to the emergency room, that you mention to them that your baby is having more trouble breathing, they're breathing harder. You can see the skin pulling in between the area of the ribs or underneath the ribs. You also might see what we call flaring of the nostrils, both sides of the nares or the nose. Those are the nostrils there. And when a child breathes really hard and is having more trouble breathing and getting the air and oxygen that they need, their nose kind of flares out on the ends. And that means they're working a little harder to breathe. And that's called nasal flaring. So you can see that as well. RSV is one of the most common reasons that infants are hospitalized in the winter months. But the good news is, knowing the signs early, keeping calm, and having a plan can make all the difference in the world. So let's talk epidemiology. And you might say, what does that mean? Well, basically, when does RSV show up? What's the seasons that you can see it in? RSV is most active during what we call the respiratory season, which typically runs from September through March in most parts of the United States. Now, you can see it in other months, and I actually have seen diagnoses of that in other months, but that's the most specific time that we see this. You want to think of that time as a stretch of the year when your kids are going back to school, the weather starts to cool down, and everyone starts to be sharing all the sniffles around and the cough and the colds. We often see cases start to rise in early fall And they usually peak around December to February and then taper off by early spring. But now, in some areas, especially warmer climates, the season can start a little earlier or linger a little longer. It's also important to remember that RSV just doesn't affect babies. It can affect older siblings, parents, and even grandparents can catch it too. It just looks a lot milder in adults, again, like a simple cold. But those same mild cases that an adult have can easily spread the virus to infants or those high risk children with their compromised immune systems. So, for example, children, again, when we talked about heart problems, lung problems, even children with immunocompromised systems, such as those who might be undergoing chemotherapy, all those things, which is why awareness and prevention really matter when you're dealing with RSV. How does RSV spread and how do we prevent it? Well, let's talk about how it spreads. It spreads through the tiny droplets that come out when someone coughs, sneezes, or even talks closely to another person. It can also live on surfaces like doorknobs, toys, or crib rails for several hours. That means when those little hands touch something that the virus has been on, it can then touch their face, their nose, their mouth. RSV can easily find its way in. That's why it moves so quickly through daycares, schools, and families. Anywhere that little share of space, toys, or hugs, that's where RSV can spread. Again, the good news is simple things can truly make a difference. One of the biggest things that really helps is washing your hands often and helping your kids to learn to do the same. Wiping down shared surfaces and toys. Avoiding close contact when someone is sick, especially with infants. So if you know someone has a cold, it's best to wait to take your infant to see them or have them come visit you at a different time when they're not sick with a cold. You also want to teach kids to cover their coughs when they cough and their sneezes. They can use that edge of that elbow, like put their nose into their tiny elbows or into the crook of their arm when they sneeze or cough. That really helps the prevention of those cough droplets that happen when one coughs or sneezes. Giving babies their own space during these peak winter months, putting them in their cribs, letting them sleep there. There are also some newer preventative tools that we can talk about, like one for mothers who are pregnant. During those months, they can have what's called a maternal RSV vaccine. They can talk to their OBGYN and see if it's appropriate for them, and whether or not they should take that. But that is available, and it's given during pregnancy to help protect newborns from RSV. When a mother is given a vaccine, it helps to pass those antibodies from the mother to the baby so they don't get the virus or the illness after they have been given that vaccine. It's amazing what our bodies can do and how our bodies are made and how women who carry children can pass these antibodies and beautiful things onto our children to help protect them. It's an amazing thing. The other thing that is available, and it's preventative that can be given, it's nirsevimab, or Beyfortus is another name for this. It's a monoclonal antibody that can be given. It provides extra protection for infants and for those children who are high-risk babies. One of the things you need to be aware of is sometimes there's a shortage of this medication, and at one point we were just giving those to the high-risk infants that had been in the NICU and had higher acuity diagnosis, because a child with a heart problem or respiratory problems or other issues that receive RS or that get RSV are at a higher risk for a more serious infection. And so just talk with your nurse practitioner, talk with your pediatrician, and they will help you decide if this is right for you and right for your child, and if it is available in your area. So that is something to keep in mind. But those are things that are available. The other thing for parents at home, I know there's nothing worse, being a parent myself, than watching your child struggle to breathe because they're so congested. It's very scary for you as the parent, and it's scary for the child. So, what are the things we can do when they're fussy and they're irritable and they're just really having a hard time feeding and hard time resting because they're so congested? So sometimes the simplest comfort measures can be really, really helpful. One of the things that you can use at home is a cool mist humidifier. You can buy those in any local drugstore, any type of stores that sell um, humidifiers. You'll be able to find those, but it's called a cool mist humidifier. And why that works is with the cool mist helps. Number one, it provides moisture in the air, so it helps with the coughing. And then also, with the coolness, it helps to decrease the inflammation. Now, if you're not able to have a cool mist humidifier, the other option is if your child is really, really congested and it's a cool evening, make sure you dress them well, put a hat on them, dress them in their clothes, wrap them in their blanket, and you can take them out on your porch for a little while. I would say no longer than 5 to 10 minutes because you don't want them to get any further sick. But it can help kind of open up those airways and help them breathe a little bit more and a little easier. Another option is steam from the shower. So if you go in your bathroom and you turn the hot water on and get the steam in the room, do not put your child underneath the running water. You do not get under the running water, but you can turn it on and you can stand in the bathroom, shut your bathroom door, and that steam will help. With some of the congestion that they have as well. Just know that these small moments of care, the cool air, the steam, the comfort of your arms, they matter. They help your little one to feel safe and supported as they heal through this season of the sniffles and the cough and congestion. So, when as a parent do you worry and when do you seek care? When it may be very confusion when to go to the doctor and when not. Well, with RSV, the symptoms start out really mild. Again, the runny nose, the congestion, cough, maybe a low-grade fever. And that's how it is in most kids, and usually they recover at home with rest, fluids, and a little tender loving care. But there are times when RSV starts to affect breathing, and that's when it's time to pay closer attention. What you want to watch for is your child breathing faster than they normally do? As we talked about, the flaring of the nostrils, the nares start to go in and out. They're having a little bit more difficult time breathing. Or as we talked about earlier, the pulling in or retracting of the skin in between or under the ribs. If they have what we call pauses in their breathing or apnea periods where they're not breathing, that's really important to watch for. Any trouble feeding, or they're just not taking good intake of their formula or breast milk, or whatever they're drinking, if they're a little older, if they're on whole milk, whatever they're drinking, they're just not wanting to take fluid in. If there's unusual sleepiness or difficulty waking, and if there's any bluish color around the lips or fingertips, if you see any of these signs, you want to reach out to your nurse practitioner or pediatrician or seek emergency care right away. And so when do you call 911 versus taking to the emergency room versus talking to your nurse practitioner or pediatrician? Well, a good rule of thumb is if you do see any color change around the mouth, if you see any color change, if you feel like your baby is having those periods where they're not breathing and then they'll start again, that would be a reason to go ahead and call 911 and have them come to your home and evaluate your child. The other areas where they might be breathing fast, they're not eating well, and they're just really, really congested and you feel like they were working harder to breathe, you can take them to the emergency room. If you are able to call your physician's office or nurse practitioner office during the day, then you can call them and talk with them, talk with your provider and talk through that and go see them. But if there's ever any concern and you can't figure out when to take them and when not to take them, it is always okay to trust your judgment as the parent because you know your child better than we do and because you're with them all the time. So if you feel like they need further evaluation and someone to take a look at them and you're concerned, then trust yourself. Always trust yourself and trust your gut and get your child seen. And that's okay. It's important to know that most RSV cases do not require hospitalization. However, when they do, the focus is on supportive care, helping them to breathe appropriately and stay hydrated. Now, your child could be just admitted to the pediatric floor, or they may be admitted to the intensive care unit, depending on the severity of their symptoms. But just know, because you take them to the emergency room doesn't mean that they will be admitted. You take them so that they can be evaluated by the provider so that they can make the best appropriate diagnosis for your child so that your child is taken care of appropriately and so that you feel comfortable and the provider feels comfortable in the care that they are given so that your child is taken care of safely and effectively. So as we move through the season of sniffles, it's important to remember RSV is common, but knowledge and staying calm go a very, very long way. Most children will recover with rest, fluids, and time, but knowing when to watch, when to worry, and how to protect our littles helps turn anxiety into action. To parents, you're doing an incredible job. Caring for a sick child takes a lot of strength, patience, and love. And to my fellow providers, thank you for holding space for worried families and bringing both skill and heart to every bedside. This season will pass just like it always does, but the compassion we show to our patients, to our families, and to each other, that's what stays. So friends, as our time together comes to a close, always remember to be courageous, lead with compassion, and always be kind. The world needs your light, so until next time, keep shining.